I would like to give a therapeutic example to illustrate the binary division under pressure and the challenge related to the temptation to collapse. It is an example taken from a time I worked in a psychiatric ward in a certain hospital. There was a young woman there who was quite violent and very problematic. It was very difficult to relate to her. The staff suffered a lot from dealing with her. And they began to say it was necessary to transfer her to another ward or institution or set her extremely severe limits. This specific dilemma is often related to child rearing, and it illustrates how under pressure the space tends to be reduced in a binary manner. When something becomes difficult or there's some anxiety, helplessness, or serious doubts about the treatment we give, the human tendency is to opt for rigid solutions of either or. Either have her leave or set harsh limits. It is very difficult to contain feelings of helplessness, pause, and allow a creative idea a chance to emerge. At that time, I provided group supervision for the social guides who presented the problem of making contact with that young woman. Some of the things they suffered from was that when they asked her to move from one activity to another, they would say, "Now it's time to go there." She wouldn't listen to them. So they would get into power struggles, all sorts of very difficult events. Now, as they further described the young woman, they presented some of her background, including a mother who from an early age saw her as a parasite. She was a very troubled mother who considered her daughter a parasite or a plague and violently kicked her out of the house again and again. The patient could not digest or bear this rejection. It was part of her own violence. The guides went on, and as time ran out, I felt a pressure building within me to be decisive and give them a solution. I felt that all I could do was to promise them that I was going to talk to those in charge, to the director of the ward, and tell her, "Listen, we should move her to another place," or give them instructions on how to set clear boundaries and how to deal with her. And that's something I don't know how to do. There was a moment when I sat down with that tension, that binary caesural tension, to determine, to give a solution. And I allowed myself not to know, to feel helpless and not to know what to do. I allowed myself to think that the worst that could happen was that they would say, "I'm a worthless psychologist who knows nothing, who only knows how to nod, who does not give them an answer." And somehow I disappeared. I sank into a deep state. I sank into deep thinking, or more exactly, a lack of thinking. When I came back from there, it was like I'd lost a sense of time. I came back with an idea, and I told them that it seems to me that for a young woman with that background, it is not possible to say, "Go there." For such a girl, the only thing that can be done is to go to the next place and from there say, "Come here." A young woman with that background of rejection. Now, this particular advice, the new idea that suddenly emerged, allowed for a moment of respite in the room, given the guides a feeling that it is possible to survive for another week with a deeper and more compassionate understanding of the patient's background. I'm not going to say that it changed the course of things in a dramatic way, but it allowed them to survive another week, which is no small thing in a psychiatric ward.